Bismillahirrahmanirrahim. Assalamu alaikum. My name is Khalid Mustafa Wasli. Today we are going to discuss this interesting case about 17 years old male complaining of mandibular protrusion, upper incisor crowding, and lack of incisor contact. On extraoral examination, frontal examination at rest, facial form of void, as you can see in the picture, and facial symmetry is asymmetrical. Transverse fifth, within the normal level, slightly narrow mouth related to intrapupillary distance, as you can see in the picture, yellow lines. On frontal examination at smile, incisors display 70%. Smile arc is incoincident, as you can see in the picture. There is no parallelism between the lower lip and incisor edge of upper anteriors. Maxillary midline is coincident with the facial midline. Mandibular midline is invisible, and there is some gingival discrepancy in the upper anterior area. Soft tissue profile analysis. He has reduced facial convexity about 7 degrees. To know this angle, we draw a line from Bogonion crossing subnasal and another line from glabella to subnasal, and we measure the angle between these two lines. Vertical facial proportion. His lower facial third is slightly longer, as you can see the measurement in the picture. Length of the upper lip is 1/3 of total lower third of the face. And the nasolabial angle 96 degree within the average. Maxillomandibular prognathism. To know the maxillomandibular prognathism, we draw a line from glabella perpendicular to the floor and another line parallel to floor crossing this line, and this angle has to be 90 degree. The distance of subnasal from this line has to be 6 plus or 3 minus 3, and it was normal here, and Bogonion should be 0 plus or minus 4, which was more than that for this patient, meaning he has prognathic mandible. Assessment of the nose. Nasofacial angle 33 degree within normal level. Nasomental angle 131 degree within normal level as well. Mentocervical angle 104 degree, less than normal because of the mandibular prognathism. Submental neck angle 125 degree within normal level. Lip position. A-line shows normal upper lip, but the lower lip is touching this line, and it has to be 2 millimeters behind this line, meaning lower lip is protruded. Bristol line shows normal upper lip and protruded lower lip. This line shows upper and lower lips are too prominent. As you can see, both of them are crossing this line. Mirifeld's Z angle is 86 degree within normal range. Interlabial gap 3 millimeter within normal level. Problem list. Vertical dimension. Skeletal, he has high mandibular plane angle, increased lower anterior facial height, increased gonial angle. In dental, he has anterior open bite 3.5 millimeters. Soft tissue, he has leptoprosopic, no incisor display at rest, and about 70% incisor display on smiling. Anterior posterior dimension. Skeletal, he has class 3 skeletal relationship, increased mandibular length, reduced convex, hard tissue profile, protrusive chin. Dental, he has left molar, super class 1, and canine class 3, right molar class 3. Canine class 3, negative overjet minus 1 millimeter, proclined upper incisor. In soft tissue, he has reduced facial convexity, protrusive lower lip, protrusive chin. Transverse dimension. Skeletal, he has asymmetric chin. Dental, he has a lower midline deviated 2.5 millimeter to the left of maxillary midline, and he has crossbite. And alignment dimension. Dental, he has upper crowding 3.5 millimeter. The other problems, he has severe restoration and gingival marginal discrepancy and minor plaque accumulation and staining. In intraoral examination, you can see the open bite and maxillary anterior crowding and the other dental problems we have addressed in the previous slide.